So, okay, so I'd like to welcome everybody to the webinar here, the HISI webinar that we've organised with Niall Sinnott from the Department of Health and John Ward, the Chief Technology and Transformation Officer with the HSE, to talk to us about the strategy and implementation plan of a new digital healthcare and social care setting. Before we get into the webinar, just a couple of things I wanted to note. We're going to do questions and answer at the end, and Siobhan, who's the the Vice Chair of HISI, is going to moderate the Q&A. So Siobhan will be picking those out of the Q&A tab if you choose to use the Q&A tab for any questions that you have. I'm Vincent Jordan. I was elected to chair of the HISI, the Health Informatics Society of Ireland, at the AGM or the meeting after the AGM that was held in early summertime. So this is part of a program of webinars that we're pulling together, and we've got another one in mind for later in October. So we'd like to, I suppose, encourage you to stay engaged with HISI. We think it's a great vehicle to bring people from lots of different disciplines and lots of different interest areas of health informatics and e-health together. So we're now going to start the webinar. We're going to hand over to John and to Niall to bring us through both the Department of Health position and the HSE position around this. And we'll be done and dusted within the hour. So thanks very much.
Thanks, Vincent.
I might start, John, if you want, just by way of introduction. I'm Niall Sinnott, Head of eHealth here in the Department of Health, previously Delivery Director in the HSE, was in the Office of the CEO. John?
Yeah, John Ward. I'm the Interim Chief Technology Transformation Officer of the HSE. Delighted to be here today.
Thanks, John. Look, we've got quite a few slides here to run through. I understand there's a reasonably big audience on the call, so hopefully it's relevant to a lot of the folks on the call. I understand there's the Q&A session, and there'll be also opportunity to comment, I'm sure, after the webinar. Just by way of introduction, we've been working together on a framework, strategic framework and implementation plan now for a couple of months. We've done a lot of stakeholder engagement so far. This particular audience will have a particular interest, I'm sure, in this area. The work is not yet complete, so we are happy to take feedback and comments as a follow-up session to this, but just bear with us as we run through what we have so far. There's a limit to how much detail we go into at this point because we're not yet published, but hopefully you get a flavour as to what we're about. John, are you able to drive?
Yeah.
So, okay, so just by way of introduction for myself at least, in the Department of Health, we have a small e-health information system unit. The functions we carry out are listed in this slide here. You know, as any other unit in the department would be, we have a policy setting function, which has been involved in some of the strategy development. We represent Ireland on digital health stuff at an EU level. Our members of the EU e-health network and internationally beyond the EU borders. Some of our day-to-day work is about securing funding and resources for digital, which I think is an important enough role in itself. Also providing sanction on a monthly basis in accordance with the deeper circulars that require all public investment in ICT to go through additional approvals through the Department of Public Expenditure and Reform. We also do the normal stuff that each department does, just typically dealing with parliamentary questions, leaders' questions, and so on and so on. That just gives you a sense as to what we do, John. Push on there. So, you know, the first question, I suppose, is why do we need a strategy refresh? Most of you'll know it's 2013 since the original strategy was done. It's 2015 since the Knowledge and Information Plan was published. So that's a long time in the digital space. Clearly, we're moving now more towards digital services rather than e-health systems. We have to reflect that because there's been a lot of technology developments. There's been great opportunities to learn from other countries, and a lot has happened in 10 years. Patient expectations, it's probably fair to say, have increased considerably, you know, in terms of people doing so much on digital now, and yet they don't see the same reflecting in the health space yet. We have some serious EU obligations that arise, and we're very conscious of those in the department in terms of what the EU requires of member states by 2030 through the EU Digital Decade, which basically says every citizen around Europe should have access to a digital health record, and we're being measured against that marker versus other countries around Europe already, and we're not doing well. And we have the European Health Data Space Directive coming along the tracks now, which is possibly going to be as impactful as some of the GDPR stuff that we see. And obviously there's a requirement to align with government digital strategy, which is the harnessing digital strategy. We'll push on there, John. So we also need to be mindful of the impact of the cyber attack in 2031, the learnings from the pandemic, the need to align with the establishment of the regional health areas or regions, the emergence of the Health Information Bill, which is being drafted as we speak, and the need to secure government approval for long-term investment, because we all know this is going to require a long-term commitment in terms of funding. So these are all the reasons, I suppose, behind the refresh. Push on, John. Okay, we know from Sláintecare that even when that was put together, it clearly called out the need for an electronic health record for everybody in the country, and we haven't yet got to the point where we're able to deliver that. And I think we all understand some of the challenges we've had over the time. We need to go back and figure out how to address that. We'll push on, John. So the pandemic, we know, acted as a catalyst for change and provide an opportunity to demonstrate the value of digital and what can be done, I think it's fair to say there was a lot of innovation, there was a lot of agile working, and there was a lot of people were given license to go get things done. I think that in some ways has been a positive. There is a positive to take out of the pandemic. Push on, John. This slide just lists some of the significant developments that were enabled by digital during the pandemic. I won't list them one by one, but you can read them yourselves. I think you're familiar with them. But I think for me, one of the things that was notable was when it came time for the vaccination program to roll out across this country, you know, every citizen was given the opportunity to log onto a website, register their basic details, look for an appointment. And there was a process by which people identify themselves securely when they arrived at the vaccination centres, and ultimately people received the vaccination as a clinical service, and subsequently received a vaccination certificate, which they could hold in their wallets, digital wallets. So in terms of an end-to-end process and an exercise in the health system engaging digitally with potentially every citizen in the country, we've never done it before. People were clearly up for it, and I think it was a very clear demonstrator as to what can and can't be done. There was lots of other good work done during the pandemic. Many of you will be involved perhaps in those initiatives. But for me, this idea that for the first time ever, we're digitally engaging with the full population was very significant. And I suppose we should be mindful of that in terms of our thinking going forward on strategy and investments, that having that ambition to have a digital relationship with all of our patients and citizens going forward. So I might push on there, John. The approach taken to the development of the strategy, has been a lot of stakeholder engagement, I have to say, up to now, but it has been informed by the existing strategy. Those of you familiar with it know there was a lot of stuff in there that's still relevant today, actually, but also lessons learned over the last 10 years. It's essential that if we're going to secure additional funding from the state, that we have ultimately a very clear North Star as where we want to be in 3 years, 5 years, and 10 years' time. Something that can be communicated to people who are not technical as well as people who are comfortable in the technology space. And it ultimately requires a level of credibility in order to secure government funding, because let's be honest, there is one-off funding probably available to the government at the moment to spend, but we're competing against other important areas like the need to address housing and other critical parts of government concern. So we push on there, John. So in terms of our international learnings, we look far and broad to see what developments are taking place in other countries, but we do see common objectives emerging from other countries when we look at the international picture. We've listed out quite a few of them there, but you can see that there are definitely clear themes that are coming through from all the countries that we look at, and we've tried to reflect those in the framework that we've put together. And just push on there, John. So some of the key points, I suppose, that there are similar challenges faced by many countries insofar as they may still have a fragmented digital health system or health system from a digital perspective, but they have managed to somehow, in most cases, certainly at the European level, pull data together and present it as in a national way back to citizens. We know that countries that have been at this have been working at it for over 20 years, so it's not something that's a quick fix. The most successful countries, like in the Nordic regions, have been working on this from before they had digital. Actually, they were into establishing coding systems and making sure their structure and how they manage their data. We haven't found, even though it's widely reported, we haven't found any other country other than perhaps Malta, who has one major hospital and two smaller ones, and therefore one EHR. We haven't found another country that has a single EHR. We have found countries that have like Finland, a place like that, that have a way of presenting the data as a single health record to the citizens. So as far as they're concerned, what sits behind it isn't of no consequence. They just see themselves having a health record nationally and having access to it. A bit like perhaps how the banks in Ireland managed to present their various different systems through a single banking app that you and I might use. But most countries have achieved this by tying together existing assets and entities that they have. And depending on how well structured they were and how well coded they were, obviously the challenge of pulling things together has been either easier or hard. We're only now starting to see evidence of the major enterprise EHR systems being deployed in parts of Europe at a regional basis. I don't think we've seen it at a national level. Happy to be corrected in the comments if anybody's seen further, but we've looked at this very closely. And we know that finally, in the context of the interest of this audience, we know interoperability is difficult, as I say, but more and more countries are finding ways to join things up in a meaningful way and to provide access to patients. So we're going to push on there, John. What else have we learned? There's more patient-focused solutions emerging to enable the patients. Access to digital health records is becoming commonplace. We're currently ranked lowest among the 27 countries that are reporting progress in this particular area. I think there are a number of other countries that are actually in the same place as us, but perhaps aren't quite been quite as honest in terms of how they're reporting at European level. But clearly, it's a source of difficulty for us at a European level. We're seeing a more modern workplace being presented to healthcare professionals in other countries, strategic approaches to clinical system investments in clinical systems, greater focus on data analytics, a shift towards open systems, and greater level of interest, I suppose, we've seen for many years now in terms of the likes of Google and Apple and some of the tech players, although I think they're still struggling to really find a niche in the digital health space in the sort of area that we would be concerned about, which is the pure clinical information. And obviously they're all mindful of the need to address the ongoing cyber threats, and we've had a number of countries come to Ireland to learn from us as to what we learned from 2021 and the work that's been done since. So push on there, John. So in terms of our engagements over the previous months, we've heard fairly consistent messages coming through, and some of them are listed here. So, the lack of standardization, interoperability, you'll all be familiar with. Workforce constraints in terms of the ability to deliver new stuff, the lack of EHRs, the challenge of trying to maintain legacy systems while trying to do new stuff, building the right skills and retaining staff, and even, still basic issues in relation to access to basic infrastructure and connectivity. The fact that we don't have very widespread deployment of Wi-Fi is often cited to us as being a basic hygiene factor at this stage, and we intend to try and address that. But these sort of things are called out as barriers as we speak to the system. I push on there, John. So look, the approach we've taken is development of the framework, and it's important to say that the department's piece is a strategic framework, which is high level. The implementation plan, the detail, is what the HSE team have been working on, and John will speak to that in a few minutes. But we would have concentrated on the stakeholder engagement, establishing a vision and mission, which most countries would have, but really expressing most of what we want through the principles, our guiding principles, our strategic guiding principles. And I'll just go through some of those in a moment. Translate that into goals, objectives, and a roadmap to trigger an investment plan. So I might just push on there, John. So these are essentially the 6 guiding principles that are formulating the core of what we have in the framework, at least. And the very first one that's called out is to use tech to enable patients to be a more empowered partner in the provision of their care. So this can mean many things to many people, but it's a major shift from a focus that's purely based on delivering infrastructure and developing the big systems. This is not to take away in any way from the need to be able to address real issues that are right in front of us, and what we hear from acute hospitals and elsewhere in terms of serious gaps in some of the core clinical systems, like lack of order comms and things like that. But it is also to put down a very clear marker that our direction needs to reflect solutions that are engaging with the full population, the full citizen cohort, and that can mean anything from the patient, a national patient app, to more telehealth services, virtual care, virtual wards, and services that patients can use themselves, digital services as opposed to big e-health systems. So, there's a marker being put down that we need to move much more aggressively into this space, because this is the way the world is now, much more so than even 10 years ago when the previous strategy was there. We want to have a more modern workplace for our workforce, and we want to invest in tools that enable people to do their jobs better. That could translate into more easy access to corporate systems, or more prevalent and easy access, things like rostering systems in corporate systems and so on. The third one here is probably the one that traditionally we would have spent a huge amount of time on, and it's meant to encapsulate our investment needs in the acute and community space in terms of a lot of the clinical systems and how we connect those up. Fourth principles is really reflecting the fact that we don't do enough. We know we don't do enough with the data we have, and we need to do better in terms of what data we gather and how we manage data going forward. From a department point of view, I can tell you that there is a lot of work done in service planning every year. There's a lot of work done on monthly reporting and so on. But the way in which we use data to direct our resources in terms of resourcing is limited by the visibility we get on data at the moment. So data-driven insights, using data to drive how capacity is managed and where to focus the attention, so that we can perhaps move away from hundreds of business cases that effectively compete with each other, and actually have better data to inform where future investment should be directed. But there are a multitude of different areas where we all know from our own experience we want to leverage data to greater effect, and that's what this principle is meant to capture and support. Number 5 is the digital health ecosystem and innovation. We still struggle with how do we bring in innovation, how do we bring smaller partners in to work with us in the health service. This principle refers to that and tries to find ways to address some of those issues, and we still don't have all the answers because we haven't yet cracked the procurement, the way in which public sector procures, but we're trying to address that. And this would also refer, of course, to basic things like trying to mobilize our digital health ecosystems that we had meeting on a regular basis many years ago and have sort of fallen by the wayside. The last one is really about infrastructure and enablers. If you look at our spend over the last 3 or 4 years, it's been a huge amount of money put towards foundational infrastructure. That's still not delivering some of the stuff we mentioned earlier around deficits in infrastructure like Wi-Fi and so on. So we can't give up on that. It's also the area where we will be directing money towards cyber resilience, which is a commitment we're very much behind, and also any of the enablers required for the other principles that are there. So if you think about data standards and interoperability standards and all that stuff that I suppose HISI would have a particular interest in, it fits within the enablers principle. So that's that one, John. Maybe the next slide here. I'm really finished. So the implementation plan, which the HSE have been developing, essentially tries to translate these 6 principles into programs and projects for investment. I would say, based on my own experience, and I hope you would agree, that success in this area depends on a number of things. I think constantly a purpose is really important. The countries that are successful have realized this is a bit of a marathon, but you need to be consistent and you have to be constant in what you do. Governance, government support, long-term financial commitment, robust government, strong clinical leadership, strong operational leadership, patient involvement. These are all aspects that are critical for our success. Strong legislation. The Health Information Bill is trying to address some of these requirements on legislation, standards, and also whatever operating models emerge in order to support the new health regions. We do understand and we appreciate that the way in which we're structured at the moment, certainly in the technical space and perhaps on some of the service side as well, it's probably not optimized to allow us to deliver what we need to at pace and to have the right level of ownership and authority over things. So I think the operating models which are being developed to support the new health regions will be critical for our success in this particular area. And finally, just to say that these also happen to align with the recommendations from 2021 from HICWA when they put forward their recommendations as to how to improve health information back then. So last slide for me really is, what does this mean in practice if we get this right? Impact of digital should be more visible to patients, number one. The modernization, we should see a modernization of the workplace for healthcare professionals. Health regions will have a great role in the delivery of the clinical and operational systems that they need to save their population, which I think is going to be very important. It should be easier through our data insights to direct resource to where they're most needed. There should be better supports for agile and innovation. We'd like to see a strategic approach to investment in the underlying infrastructure and also in all the enablers like standards and consent models and so on. But whatever we do in the digital space, we need to be mindful all the time that equity is essential. So we must make sure in what we do that we don't leave groups of people behind us. So I might at that point just hand over to John to basically talk about the corresponding implementation plan. But just before I do that, I suppose, if we think about what happened in 2013 and what typically happens or happens very often in the department will issue a policy or a strategy, and then implementation, may or may not happen. In 2013, it was 2 years. There was a 2-year gap between the publication of the health strategy, of the e-health strategy by the department, and then a corresponding knowledge and information plan by the HSE. So I'd like to just say at this point that we've been working hand in hand with the HSE team all the way through, and their implementation plan is as a result of that close collaboration, and the two should be published in fairly closely to each other time-wise. John, thanks for that.
Thanks, Noel. Okay, well, listen, I maybe just to rephrase, because there is a collective ambition that Noel has called out. What I'm going to do is just talk about how we've taken the principles and the goals, and actually even in terms of some of the engagement we've done it collectively. So it's not the HSE showing up to one meeting and the department to another. We've been doing it together. And I think it's really important that this is seen as a collective approach. And the second bullet point there is really key. The collective approach allows us to establish that solid foundation. It is about going to wider government. It is about gaining approval for the investment in a coordinated way. And I do think the other thing that we've done is the principles that have been outlined in the framework are going to be how we set the narrative for any of the e-health work that's going to happen in the HSE for many years to come. So by phrasing and changing to align, it's very clear, that the policy is being implemented through a plan, and we can tie that back in terms of, where is the requirement coming from, what's the principle we're trying to drive. And actually, each of these principles have goals and objectives, and we can measure some of the initiatives that we put in place against those goals, principles, and policies. In terms of the approach, what we have been doing, and this journey started, to be honest with you, it was probably late last year we started preparing for this. But we were looking at this from a HSE perspective, but then reflecting on the fact that the department were actually looking at refreshing the strategy, we decided to do this in cohort. And there was a 5-step process that we worked through. I think the first one is stakeholder engagement. And again, just to reiterate that collaborative approach, rather than actually going out and having those individual sessions, and I'll get to some of the stakeholder engagements and the type of people we talk to, rather than doing that individually and maybe hearing different things, we did it collectively. The second thing we did, and it was a capability assessment, it was using HIMSS in terms of where we are. Now, it was system-wide. Each setting might have different capabilities. We want to use that to guide us, because originally we were looking at, well, should we use this capability to frame the initiatives in terms of addressing that? But actually, the real key step was from 2 to 3 in actually aligning. So the principles that were defined by the team in the department, we aligned to that. So all of the activities and the things we felt we needed to be doing, we bucketed them into these principles. So then we could actually start to do what initiatives are required in each principle, and not only the initiatives, but look at the funding requirement, the time requirement, the resource requirement in each of those to ensure that the portfolio and the funding is balanced across all 6. I think Noel mentioned, there's been a significant investment in some of the foundational elements since the cyber attack. But we actually need to make sure we balance that across the system, that we're actually putting technology in the hands of patients, but also clinicians and delivering integrated care. And then the last one there is prioritize and plan. Like, that's not something that's done once and finished. That will continue for many years. But we do have, and we've grouped a series of the initiatives we come up with in what we call now, next, and future. And there will be further work to be done on that. Each of these initiatives is complicated by nature and will require individual programs to be established. And I think the key thing about where we're going now is we're starting to mobilize. I think while this document hasn't been published, there is a step 6 here. We are working on the basis, because we're in service planning at the moment, that the strategy and the plan are the way forward for eHealth, and we're prioritizing the initiatives both from a service planning and an ICT capital plan against the principles. We don't want to wait for it to be published, because this happens once a year. We don't want to miss that opportunity. So just in terms of some of the stakeholder engagement, this is part of it, but I'm sure many of the call have been in one or a few of these sessions, right? We did surveys, we did lots of workshops, we did specific engagements with private sector, with Department of Enterprise, Trade and Employment. We met ministers. We have done a huge amount of engagement in terms of forming the views of what initiatives we need to deliver. And also, from the department's point of view, they want to make sure the principles were captured right. We wanted to make sure that the initiatives that we were focused on are delivering the need and the feedback. The survey respondents and the type of people you can see, 65% are clinical, 35% non-clinical. That was really important for us, because we know there's lots of frustration in the system about people having the right tools to do the right job in terms of where they are in the setting they're at. There is frustration in the system because, as Noel has mentioned, we're not doing great in terms of international ranking from a digital perspective. And a lot of our clinicians have come in from other countries where the tools they have to hand, maybe were more advanced, more integrated than we have here, depending on the setting, of course. But I think this has formed the basis of, and when you look across the different principles, different people and different stakeholder groups have different initiatives that they're focused on within each of those principles. In terms of capability assessment, listen, I'm not going to dwell on this. This was a point in time exercise. You can see from a maturity perspective, there's a lot to be done. We used this as a point in time, but very quickly we pivoted to the department's principles. Now, Niall has outlined these at a high level. He's given the titles, but there are narrative underneath in terms of what we're trying to achieve. So once this set of principles was agreed, and we did have many sessions in terms of wording, and there are certain initiatives in each of these principles that you might argue maybe that should be in principle 3, maybe that should be in principle 2. But overall, I think holistically we have full coverage across what it means to deliver digital healthcare, and the ambition in the plan and the ambition in the framework is there. It's really about mobilizing these initiatives and actually getting funding. So once we got this right, these were the principles based on all the stakeholder feedback, based on the capability assessment. We started to map the initiatives that we felt were required. And if you look at this from a left-hand side, this is a set of principles. We have arrived at 48 initiatives, and initiatives are long-term, programs of work that deliver the objectives of that principle. So if you look at patient as empowered partner, we have 10 key initiatives in that. There's a load of sub-initiatives within that, but think of these as major programs of technology enablement. In digital enabled workforce and work plan 5, etc., etc. If we look at the actual initiatives themselves, on the next slide, there's a couple that you're probably already seeing. You'll see these narratives out there already. So if I go to the next one, this is the initiatives, and they're named. There's a significant amount of detail, but already, hopefully you're hearing in the system some of these initiatives. What's happening, when they're happening. I'll give you a couple of examples. So shared care record. Shared care record is in the digitally enabled and connected care. That's a critical requirement for us to be able to bring together lots of patient data into one view, the shared care record for that patient. It's also an enabler for us to deliver on some of the EU requirements. We have the patient app. So you would have heard and probably seen in the news that Bernard has announced this. The patient app will be delivered in 2024. And actually that patient app is not going to remain static. That effectively is going to be continuously added. It is not a one-year thing. It's a multi-year investment in terms of adding capability to that patient app. In terms of some of the things that we need to do from the digital secure foundations and neighbors, if we are beginning on an investment cycle for technology, one of the things we really need to do is strengthen our data standards, our interoperability standards. So there's a significant amount of effort that needs to go into that to make sure that if we're bringing systems in, that they're done that in a holistic way. There's a whole estimation process that has gone behind this, and there's a lot of detail. I won't necessarily give you the numbers, but I might just give you sort of the ratios. And I think Niall hit it earlier on. Across these 6 principles, if we take 100%, the digitally enabled and connected care is a significant portion. It's over 40% of what's required. And that is actually us delivering on these systems of record required to deliver clinical care, the DHRs. So that is the most significant. The next most significant one is the digital secure foundations and enablers. And the reason for that is if you're providing capability across employees of 140,000 plus, there's a cost per employee to do that. So the scale of the health system requires us to be able to support all of those to do their job. The others, are smaller in scale, but they're not insignificant. I do think, the patient as empowered partner is actually one of the things that we will be really focused on next year, which is actually going to drive improvements into the system. So by actually giving the patient the data in their hands, that's going to drive a demand. There's an expectation from a digital perspective that they can deliver, which is going to drive demand into the other areas, such as digitally enabled connected care and data-driven service and capacity management in terms of appointments and referrals, etc. I think for us, we've got this strap line. It's, one vision, 6 principles, 48 initiatives. We're going to stick to that. It's how we've started to communicate. And then the numbers behind these, we have to make, we have to work them through the system in terms of actually, are we going in on an initiative basis? Are we going in on an overall plan basis? It's probably going to be somewhere in between. In terms of the prioritization, and within 48 initiatives, there's a significant amount of prioritization that's gone on in the background. But in terms of just where we are, right, for 2023, like one of the things we have said, we do not want to be stopping things that are in the process, and the reason for that is we haven't yet, got the plans, the funding in place just yet. So we are continuing with the lifetime existing programs. A lot of them have significant merit. And really 2024 and 2025 is about delivering some key initiatives. In terms of some of them will be, trying to address certain deficiencies in certain cases, where there's a real legacy challenge, but also doing the preparatory work for getting towards that North Star. Continuing to scale the foundations and enablers. We are really going to have to invest, particularly in that interoperability space, in order to ensure that we can deliver and bring this all together to give a holistic picture of integrated care. And then also, I do see significant procurements in terms of actually delivering on this plan because it's ambitious, it's large, and to my mind, if we get this the necessary government support, it'll be at a scale that we haven't seen in the health sector before. And then over 26 to 2030, keeping delivering those initiatives based on the plan. But you're going to see us continually coming back to these 6 principles. What are we doing in each of them? And making sure that the portfolio is balanced, that we're not doing one at the expense of other, that we're doing a balanced approach across all 6. In terms of the initiatives, just in terms of there's a whole detail behind which ones are now, next, and future. But I've mentioned things like the app, shared care records, they are imminent. And then the future ones are not that we're not doing them. We just need to get some enablers in place some capabilities in place, and then look to the future. If I summarize where we are, I think hopefully, for you, working in this sector, myself and Niall coming together here, sharing this, you can see that the collaboration is working. We are aligned. I'll go back to the point that Niall made at the start, which is that the last strategy was delivered in 2013, and the knowledge and information plan was delivered 2 years later. That's not going to happen in this case. So we have really strong collaboration. One vision, 6 principles, 48 initiatives. We have strong and universal alignment. The documents we've prepared, we have socialized those. We have got feedback on them. There is some really good feedback, but one of the reassuring things is we haven't heard that there's anything fundamentally missing from what we're proposing. If it was fundamentally missing, we've caught it by now. So maybe I'd say that in relation to some of the later iterations. So we do have strong and universal alignment on the strategic direction. I mean, what we're saying is nothing new. I think if you look at other countries, that are ahead of us, this is things they have done before. On the funding, just to call it, there is a resource required to meet the ambition in the framework. The whole multi-year planning team is something, we do a yearly service plan. So we are, I suppose, looking to bring this collectively to deeper and wider governments to ensure that the ambition that we have in the framework is supported by government. And quite frankly, I think it needs to be, or it has to be rather than needs to be, because we simply cannot hire the staff and we can't build the buildings in order to do what we need to do for healthcare. We are, struggling to get people into the system. So digital is an optimizer, it's an enabler. And if we do it right, we can actually deliver a lot more care with a lot more of those fixed resource type things and challenges we've had. I think the other two things we really need to do is obviously the health region implementation. We are in the midst of a major organizational change in the HSE, and we do need to align to that regionalization agenda. Like the plan is centrally delivered, I say, as in like the documents we're producing, but that will be changed to centrally governed, regionally delivered. And depending on certain programs, there might be a balance of more central, more region, but we need to work through that. And I think the last thing is the defining the appropriate level of governance where transformation at this scale is needed. We do want to make sure we get that right. We're working on that at the moment. So as I said before, despite the fact that documents haven't been published, we are operating on the principle of we are mobilizing now. We are putting it into service planning, and we are putting basically papers down in terms of what governance we need to drive this. We have socialized this with all the leaders in HSE. Bernard is a strong supporter, and actually did call out in the session we had that this is really something that he needs to drive as much as the technology people. I think the key thing is, and I'll just finish on the quote that Richard Green has said many times, and is that this is not a technology strategy. It's a health strategy to maximize digital, and that's probably not exactly how he said it, but that's what he meant. Is that this is not technology. It is about improving healthcare through digital and technology, and that's the difference. So we do need buy-in from our clinical services and management support on this. So I'll pause there. I think we're just on time for questions. Vincent, and hand back to you.
I might just make one final comment if I can, Vincent, before we get into the Q&A. I think it's important, first of all, typically when these things come out, people are looking very frantically to see, oh, is my project on there? Is it not on there? That's a normal, natural reaction when plans come out. But I think it's important that we all recognize that the principles and the way in which we choose to allocate the proportions of funding between the different principles is what's most important. What happens within each of them to some degree can be worked out over time. Certainly the bottom-up approach to adding the cost of the things that we already have listed through the plan are pretty eye-watering numbers, but we're still going to pursue that with our friends in DEEPR and government and so on. being practical about these things, this all could translate into additional funding each year going forward. And we still, in that scenario, we may still be left with choices as to how to prioritize within the additional funding that we get each year. But the last thing I want to say is, let's not lose sight of the fact that despite many of you not seeing the change on the ground being visible, over the last 5 years, I was just looking at some numbers there, we've tripled the amount of capital into ICT in the last 5 years. We've tripled the amount of revenue. We've tripled the amount of resource. In fact, we've tripled the amount of resources in terms of staffing. Not evenly distributed, not always just visible to everybody. But just to give you some idea, numbers, capital in 2018 would have been about 60 million a year. We're 140 million this year, and we've just allocated a further 30 in Q4 this year. It's 170 million. It's nearly triple the capital. Revenue's gone, that's controlled by the Office of CEO, has gone from 50 million to 172 million. We've put the guts of probably 50 odd million into building our cyber resilience, and we'll do that again probably next year. And the staffing numbers have gone from maybe 360, 370 up to 950 plus 300 contractors. Like, these are significant numbers, totted up together, including money that's spent by the rest of the system, paying telephone bills and other month-by-month type payments. We're probably spending over $500 million out of our 20 odd billion today on digital and ICT in some shape or fashion. So as well as thinking about how much we invest in the future, we also need to ask ourselves, how best can we use, are we happy in terms of how we're utilizing the funding we have at the moment and the resource we have at the moment? I don't think that's an easy fix, but I think there's certainly some merit in trying to re-examine that and look at whether it works well for the regions, whether it works well for industry, whether it works well for the wider health system. So just finish on that comment, maybe, Vincent, if that's all right. Thanks.
Yeah, thanks, Niall. And look, it's super to see the progress that's been made in a relatively short period of time. And I think that what we learned through COVID about trying to be responsive to the needs of the population and actually move quickly, I think that's been demonstrated in how quickly this has come together. I think, as you say, the joined working is really super. And so, I think that we've got a wide stakeholder group in HISI, and from industry and across the board, lots of people will see something in this that they'd like to get into the detail on. So we look forward, I think, to the publication of the details in due course. And we might even get into maybe some more HISI sessions on particular elements of that in due course. But thanks very much for that introduction. And Siobhan, I don't doubt that you've got some useful questions coming through here to get into some more detail.
Absolutely. And of course, yes, thank you, Vincent, and thank you very much, Niall and John, for a really insightful presentation. I think we've all heard bits of it, but to hear it all pulled together is really helpful and informative. Lots of questions obviously coming through as well. So I'm going to try and summarize some of the questions together, because some of them are repeated and some of them we, I suppose, expected to come up. And I suppose the one that probably on the tip of all of our tongues really is about, you've got great attendance today, quite a broad stakeholder community within HISI. And I suppose really, how can HISI members help with the delivery of this plan? So, how can we collaborate, of course, with you as well to ensure success? And I suppose, that role of industry in the broader ecosystem engagement, maybe you could comment on that, please.
Yeah, I think, do you want to go first, or?
No, you're far away, John. It's okay.
Yeah, I think for me, and I use the analogy, I've had a couple of conversations. I think it's really around we're all in the same boat, rowing in the same direction generally. And I think if you can put, because often what does happen is technology are trying to convince people, because they're very busy in the health sector, because they're dealing with crisis, that I can't deal with that. But if you can try and get it on the agenda, make sure that your teams, whether it be clinical teams, are aware of this and it's happening, to get engaged, whether that be through our clinical leaders involved in the process or our technical leaders involved in the process. We're doing as much socialization as we can in terms of what we're doing, but it's such a large organization, it's a large sector. If people can actually, we can push, if people are pulling, demanding change will be helpful, because that will help us, set the context with both people who want to prioritize, because it's not just ours prioritization, it's a sector prioritization. So I just think if you can lobby on our behalf, that'd be great.
Yeah, and just at the risk of flooding your inboxes, where do they go if they do want to reach out?
Yeah, well, it's ctto@hse.ie, so I do have some help managing that inbox. So if people do want to engage, I'll give Caddy a heads up and let her know to expect volume. And Niall, if I can't answer them all, I'll give you Niall's email as well.
I don't have the luxury of somebody looking after my inbox, but maybe just to comment on the question, Siobhan. I know from my own experience in terms of going to the HISI sessions in years gone past, when we were able to physically all get together, which I hope will happen again, that there is a very rich source of knowledge, experience, and information, and people, resources among that community. They sort of get the whole digital agenda in many ways. So, that's extremely valuable when you think about trying to mobilize things in a particular way. It's not obvious straight away as to how best to utilize it. So we might give some thought to that. But perhaps one practical way of doing this might be if we can express with the HISI group where we are in the journey. And in some ways then that HISI members can come forward, whether they're private companies, hospitals or private hospitals or public or other parts of the health system or people with health informatics or clinical experience. They themselves might recognize what we're doing and say, that's something where I can contribute, or where I've got a view or whatever. And perhaps that is a way of triggering the right level of interaction, or becoming part of working groups or whatever it is that's needed in order to mobilize some of the initiatives that we have. So it's not entirely obvious, but that may be a practical way to do it. And that puts a responsibility on us to, I suppose, communicate through HISI as to where we're at, so people know when and how they can plug in. Don't know if that's helpful, Siobhan, but that's perhaps the suggestion.
Yeah, and I see Vincent nodding his head as well. So I think we definitely maybe take that way as an action from today's session as well, that we can maybe take that further. And quite a few questions around more details, and I appreciate you're giving us as much as you can. People looking to know when can we find out more, how can we get more details, but also I suppose questions around also the ambition of the plan and I suppose what are the challenges to deliver, and particularly with I suppose the regional health authorities and how I suppose how that's all playing out. So maybe you could comment on I suppose capacity to deliver and also the evolving landscape as well.
Yeah, maybe I'll go first again. I think from a capacity perspective, I would say that if this was 3 or 4 years ago, you might say, well, it's impossible. I think, but given like over COVID, the HSE has proved it can deliver, when support can be provided. So I would say in terms of it's going to need a lot more than what we've done before, but I think in terms of actually giving the right supports and with the right focus. I think one of the challenges in HSE is that everything's priority one, because it's such a important business to be running, and it's actually trying to be focused on the implementation. I do think, the scale, it's not like it's going to take a combination of capability within the HSE. It's going to require market support, and it's going to require government support. So this, the vendors that exist out there, they have probably done more work in other countries in terms of the implementation of some of these, and I think we need to engage in that, and that has happened in certain cases. So to me, it's not just a HSE delivery capability here; it's an ecosystem delivery capability, but will have to be led, managed, supported, governed by the HSE to make sure that they get, I suppose, what they're looking for from the market.
Yeah, I might just comment as well, if you want, Siobhan. So I suppose, we did have at a point in time a digital health ecosystem meeting on a regular basis. And, the question is, are we leveraging the marketplace and the combined skills and knowledge and bandwidth that's out there? I'm not too sure if we're doing that at the moment as effectively as we could do. Despite the fact that additional resources have gone into the system over the last number of years, there's plenty of priorities and somehow everybody's still busy. So one of the reasons why we're revisiting the strategy at the moment is to say, well, look at how we choosing to set priorities and what messages are we sending out to people so they know that while they're busy, that they're working on the right stuff. So I think that's really important. In terms of where we want to get to, we had a strategy many years ago. It called out the need for national EHRs. We have a Sláinte Care report calls out the same thing, and yet we're still not there, and we still have that ambition. I would say in terms of resourcing, talking about EHRs a couple of years ago when you had barely enough people to run the basic services, I think was a bit disingenuous, actually. I think we're in a slightly better position now, but there's more to do. In terms of where we want to get to, clearly the EU target is for all citizens in all countries and all member states to be able to access their own digital health records. And that might seem like quite a lofty ambition, but actually ultimately it does give you a target to work towards. And then it's up to us to determine how we get there. Do we choose to invest in large enterprise systems, or do we choose to deploy in hospital systems or regional systems that will help us to get there? But ultimately, that's where we want to get to. We want to be in a place where we're using digital to maximum effect, and certainly in terms of health records, that we have a way of connecting them up, as we always have had this ambition, and to do that in a way that's meaningful, both for the patient as well as the healthcare professional. So that's our ambition.
Thanks very much. Vincent, do we have time for one last question? Or
yeah, last question and a quick fire answer, I think would be super.
Brilliant. Okay, so I think there's quite a few questions coming in. I suppose within the HISI community, we talk a lot about standards, interoperability. I see it myself. You want to get a system in, you put it in, but there's no time to connect it. And now we're getting to a point where there's a number of systems not talking. So, and even with new systems being put in, I suppose, is there enough guidance, templates around the data sets that need to be connected, the standards they need to be using, so that they are connected and you're investing in the future? Could you maybe just talk to that briefly? Because I think that's certainly something that's come up in a number of questions from people today.
I think I'll just maybe give you a quick, I think at the moment, no is the answer, but that is one area that we are looking at to do imminently, to make sure that we are picking the standards, because if we're going to continue that, because you're right, people go to get systems, it's very hard to pull them back and say, well, you should have done this. We need to be upfront with that. So there is a piece of work going on at the moment as part of the plan to say, and you're looking at in that bottom principle, it's interoperability standards is a key initiative. So yes.
We just to say, Louise McQuaid from HICWA is working on my team at the moment, and actually she started getting into quite a bit of a detail around interoperability and standards within the framework, and we almost had to step back and say, well, actually that's a bit too much detail perhaps for the framework, but there is a lot of knowledge there, which Louise will share through the implementation plan as well. You're right, it is a key issue and it's not easy. What I would say, on reflecting on why now and what's changed over the last 10 years, we do see quite a maturity in this particular area in terms of how these standards are starting to settle and gain momentum in certain parts of the country, so certain parts of the world. So I think one of the advantages by coming late is that we can pick the things that seem to have gained maximum momentum and seem to have established themselves very well. Even things like HL7 FAR and things like that, and are starting to settle into being accepted quite widely. So I think there's some opportunities there that weren't there many years ago, and that's to our advantage, I think.
Thanks very much, Niall. Thank you also, John. That's been really interesting. I think, as I said, we've got a HISI as a forum brings together people from all parts of the ecosystem. So it's nice to see that reflected, at least in the thinking, if not explicitly in the summary that we've seen so far. I don't doubt everybody will be very interested in some more details as we get towards publication of the reports, both the framework from the department and the implementation plan on the HSE side. So I think there'll be a lot of interest in seeing that detail. And we may actually in a few months do another session that maybe we can find a way to do that actually brings some of the feedback in. And as you say, now people seeing areas where there's maybe some more detail can be added, or indeed participate in delivery. So really, really interesting. So thanks very much. And thank you, Siobhan, for making sense of that long list of questions that are there.
Will the slides, sorry, one last question is, will the slides, I think everyone wants to know, will the slides be available?
John and Niall, the slides, I hope we can make those available on the HISI website if you're okay with that.
Yeah, I think so. Maybe no, we'll just double check that. Listen, I think that the webinar has been recorded, so they're in the digital domain. So yeah.
Okay. So we'll get some material available, and we'll publish that through the HISI website. So yeah. So thanks very much. As I said, we've got a number of other webinars in the planning process. We expect to have at least a couple of sessions. We are hoping to have a face-to-face as part of the Better Together conference that the nursing development unit is pulling together at the end of the year. So we might have a short session in that is face-to-face. We hope that you as the members will continue to engage in the HISI forums, and we look forward to seeing many of you again. We had about 280 people, I think, at one point in the webinar. So obviously very big interest here. So thanks very much to all of you participating. Thanks again to Niall, Siobhan, and John. Okay, thank you all.
Thank you.
Thank you very much. Bye-bye.